Copyright on this material of serious questions belongs to Beverly Lutz, who is also the narrator for this series and author of the book God Doesn't Care What You Wear: The Limitations of Our Beliefs. These questions are done in a specific sequence, so if you haven't listened to the previous one, please do so. So on to serious question number 2. Have you noticed if one of your primary needs has become the need to know the number of new cases of the COVID-19 on a daily basis? Further, is it important to you to know the number of daily deaths? Do you feel these figures accurately present the situation, or do you feel they are misrepresented? The media, and more importantly, those feeding the media information, have, from my perspective, been incredibly socially irresponsible in misrepresenting the data, along with their alarming and fear-producing presentations. Indeed, are you aware of how just the continuous use of the term COVID has actually become a trigger word, inducing anxiety and fear from the very way it is spoken by media and others, like a killer lurking around your corner? So let's review a few things. All flus are from a virus, which is why an antibiotic will do nothing regarding the symptoms. This current virus, labeled COVID-19, is in fact a coronavirus, and this is certainly not the first coronavirus experienced by humans. Indeed, since the year 2000, we have had 2 other coronaviruses, SARS and MERS. Viruses, in keeping with their nature, have a survival mechanism, which is why they adapt to survival by slightly changing their form. They mutate. So yes, there is a new strain of the current corona COVID virus. While this new strain may appear to be more contagious, the severity of symptoms from virus mutations are generally less severe, as is already being noted. So let's go back to the beginning of what I'm calling this madness. Someone, somewhere, considered to be an authority, declared this strain of coronavirus to be a pandemic long before it was ever an official pandemic. That set off a domino effect so that the very word pandemic was spoken continuously, embedding it in everyone's consciousness. Fear was set. Yes, the numbers sound alarming when spoken multiple times a day on every media possible, and the numbers appear to be increasing is because through the created fear panic, more and more people are rushing to get tested. Prior to this surge, if people were not feeling well, but were not seriously ill, many simply stayed home. Now, with the push to have everyone get tested, it's obviously pushed up the numbers. But here's what I want to ask you in relationship to this. When do you ever recall the numbers being given on a daily basis when there was a severe, more virulent flu season? Or for that matter, with the SARS or the MERS epidemics? As I mentioned in the first audio, every 4 to 6 years, there will be a more virulent strain of, for example, the flu virus. You will absolutely hear about it through the news, and friends will tell you what a nasty flu it is, and you very likely will experience it yourself, flu shot or not. Yet my point is, do you ever recall hearing daily fear-invoking reports saying how many new cases of the flu there were for that day? No, when in fact there is no way to even trace the number of positive flu cases at any given time because reporting new flu cases has never been implemented. Deaths also occur from the flu due to complications, as well as with both the recent epidemics mentioned. And although deaths were occasionally mentioned by the media, no numbers were given as they are today with this virus. Further, when can you ever recall going for a test to determine you had the flu? Never, right? So why would you now dash to get tested if you have even the slightest of any symptoms that are apparently associated with this coronavirus? Ask yourself, why do you think it was determined that the numbers should be released and on a daily basis, no less? Now, I realize those in opposition to what I'm asking would reply it was the most logical way in which to control the spread. Yet I wonder. Such fear-provoking tactics psychologically go a long, long way in creating a mass agreement, including an almost hysterical compliance now to the absolute need for a vaccine. Of course, it's each person's choice to vaccinate or not. Yet what I find disturbing about the manner in which the vaccines are being pushed is that this is giving those in compliance reason to point their blame fingers to all non-compliers as not being for the good of others. I don't know about you, but the very intent of separating those who have had a vaccine from those who have not is both shocking and highly alarming. Doesn't the idea of mandatory vaccine hit some huge alarm bell for you? Sure does for me. And the proposal for a vaccine passport is so seriously dangerous and disturbing that I really have no words. Have you really thought about what these mean in terms of your personal democratic freedom? So why is it that you make sure you hear those numbers? What do you feel in your body every time you listen to the news and hear those numbers? Please remember that a huge number of those who do test positive are actually asymptomatic, meaning no symptoms at all. In fact, as of October 28th, 2020, that number was over 40%. Now, add to that the huge number of folks who do get symptoms which are not severe. And we've covered a very large number of positive cases. I'll throw in here also that the rapid tests are now proven to not be so reliably accurate, as stated on NBC November 21, 2020. In case you missed this, Elon Musk had 4 COVID tests done in the week of November 16th, 2020, all on the same day, all the exact same test, all done at the same facility, all administered by the same nurse, and all processed the same. 2 tests showed positive and 2 showed negative. Now, I appreciate there's a huge American focus on the number of reported cases of COVID-19 and the number of seemingly COVID-related deaths for the United States. So let's look at some pure numbers. For 2020, up to and including November 22, 2020, in the U.S., there were 262,390 reported COVID-related deaths. Or we can use the now popular term of excess deaths. This comes out to 0.08% number of deaths relative to the total population of the U.S. In order for this to even reach 1%, would require huge numbers of COVID-related deaths. True, the stats as of January 1, 2021 show that the number of recorded deaths in the U.S. for 2020 is expected to be the highest in history, albeit the increase certainly cannot be attributed solely to the pandemic. Of course, regardless of the numbers, we can most likely agree that no one wants to see a loved one die, whether their death seems premature or otherwise. Yet even using the projection of a total of 310,000 COVID-related deaths in the U.S. for 2020, the percentage of COVID-related deaths in the U.S. population would only be getting close to 0.1%. Actually, it's 0.093%, so still a ways to go to even get to that 0.1%. As a side note, please do not confuse the current numbers you are hearing on the media for the number of COVID-related deaths with what I have just cited for the year 2020. Yes, of course, the number is higher now because the data is including 2021 in that total. I would also like to add that not all of the deaths attributed to the virus were indeed medically verified as being attributed to the virus per se. So, besides the 0.093% of COVID-related deaths in the US in 2020 being an incredibly small percentage, are you aware also that over 40% of US folks have at least 2 compromising health conditions? And over 60% have at least 1 compromising health condition? New York Times, March 12, 2020. So, don't you think this skews the data when we know that the overwhelming majority of COVID-related deaths have been among those with compromised health conditions, regardless of age, because their immune systems cannot work to their full potential? If someone is in a long-term care facility, does that not all on its own speak to a diminishing health regardless of age? Of course, there are going to be a lot of deaths in this care facility population, as with any contagious pathogen there. Add to that the various ways in which the healthcare providers unintentionally can pass the infection among the patients. And we are very remiss if we don't also include here the mental impact on all of those in care facilities that this situation has brought to bear. Not being able to see loved ones, being restricted even further in their communications and contacts with others in the facility, I have no doubt further lowered the immune response for many. A tragedy all on its own, not to mention those family members who weren't allowed to be with those in transition. A shame, really. Further, when citing COVID-19 related deaths, no mention is made of how marginalized people and those living in socioeconomically challenged areas of high density, poor dietary standards, and unsanitary conditions are also battling with a reduced healthy immune response, and as a result present another large segment of the COVID-related deaths. And lifestyle choices need to be added in here. Poor dietary habits applicable to large segments of the developed world population. Little or no exercise, poor sleep habits, just to name a few. Yes, of course, in the tragic losses of life from the COVID-19 virus, there have been deaths in otherwise seemingly healthy individuals with no known compromising condition. That happens, not just with this virus, it happens with life. So it's not to say that everyone who has passed away from COVID-related complications had a compromising condition. However, it is important to make the note that the vast majority of deaths occurred among those with less than healthy immune systems. Now, the term excess mortality is a term many preferred at this time. So, to quote, excess mortality is a term used in epidemiology and public health that refers to the number of deaths from all causes during a crisis above and beyond what we would have expected to see under normal conditions. End of quote. Yes, using excess mortality, the numbers are much higher than simply using COVID-related deaths. However, this is not simply due to COVID as many may want it to appear. We are, for example, seeing the highest suicide rate in recorded history. Deaths from drugs have more than doubled since the beginning of 2020. In its own category are deaths from alcohol poisoning and pharmaceutical overdoses. There have been countless deaths that have occurred through delayed urgent surgeries, along with severe lack of medical accessibility to needed health care because of the medical shift in focus. So while many might want to argue that the excess mortality rate shows just how serious this pandemic is, I am suggesting the increase in mortality is not due solely to the current coronavirus pathogen. Further to this, and going back to my comment about the U.S. deaths in 2020 being the highest in history, I want to give some numbers to this. There is a near hysterical tone from the media in saying that the number of deaths for 2020 could turn out to be 3 million, hence the highest number in history. However, what I want to point out is that in the previous year, in the US in 2019, the number of recorded deaths were 2,839,205. So now the horrific 3 million deaths projection is a mere 160,795 over the number of recorded deaths for 2019. Source for the number of deaths in the U.S. in 2019 is CDC, the Center for Disease Control. So now let's go back to my original question here of why do you feel the need to know the number of new cases and the number of deaths each day? What part of you is that feeding? Are you aware of how fear-provoking just this simple relaying of numbers on a daily basis is? How each day embeds the fear deeper, participating in ever-increasing anxiety, resulting in reactivity? Have you noticed the stress on you just from the constant repeat of the word COVID-19, a phrase which has become symbolic of danger? And here's a big question. How would you be if what is happening did not have a name, a label? I'll tell you a short story to make my point. I had a client years ago with what she described as serious environmental allergies. She would even bring her own sheets to my clinic to make certain she would not have reaction to either the laundry soap I was using or the fabric itself. Everything her family did or didn't do was determined by this client. What movie theater they went to, what restaurants, and even what her children were allowed to play with. It was an amazing control mechanism. One day, I gave her the following homework. I said, what if, when you arrived for this appointment, I had just had the shrubs next to my walkway sprayed, but you didn't know that? Would you have had an allergic reaction? Versus, if I had put up a sign saying that I had sprayed, would that make a difference to you? 3 guesses as to her reply, and the first 2 don't count. So this is similar to what I'm asking you. Because there has been a label put on this current, dangerously life-threatening virus, one that has become seriously embedded in everyone's psyche because of things I've already outlined, how does that impact your reaction to the news? What if this virus did not have a label and was simply a nasty bug going around that a whole lot of people are getting? What's curious to note is whether or not you want to add in rebuttals to what I've said here. Do you want to argue against the logic of the numbers, for example, that I presented? I certainly know lots that do. As I said earlier, I'm not saying I'm right about anything. My intention is to provoke, to perhaps in some way create more curiosity and more openness, more critical thinking instead of mass following. Any numbers I have used are pure numbers, not statistically skewed to give a certain result. Okay, so let's move on to serious question number 3. And remember, stay curious. Beverly is an inner freedom coach who works with individuals and groups around the limitations of beliefs. For more on Beverly and to purchase her book, please visit her website of newparadigmhealth.com.